Hello everyone, welcome to the Voice of Nursing. My name is Adrian Tracy, CEO of ICG. Very lucky here today to be joined by Ewout van Sabben. Have I got that right?
Yes.
Newly qualified nurse, so someone with a slightly different perspective about what's going on in the nursing community, but really lucky to have him here today. Welcome, Ewout.
Right, thank you very much. Thank you.
Well, tell us a little bit about how you got into nursing.
I'm a little bit older than a normal nursing student. That nowadays is happening. So I am now 33 years old. I started off in healthcare when I was 16. So in the Netherlands, where I'm from, I actually did a healthcare course, supported living course. So my end qualification was to be able to work in care homes with patients with learning disabilities, behavioural problems, mental health issues, you name it, you could work with it. It's a 4-year degree. Afterwards, it's like a BTEC level. Okay. So here you would come out with a national diploma, and you then work. But I did that until I was 29. I worked my way up to become a team leader in a care home, and I was kind of like hitting my limit. I'd seen and done a lot. I've worked with children, with like young adults, with physically disabled, with learning disabilities. I've worked with such a variety in private care and like in the normal healthcare sector in the Netherlands as well. And I was ready for a change, and I was like, do I want to go completely away from care? Or do I want to hone new skills and actually take what I've learned for the last 13 years and put that into a new pocket? And that's kind of what I did. I got into nursing because I wanted to do more in my caring profession, and I'm happy I did. And I particularly did child nursing because I've always wanted to work more with children. I did lots of volunteering when I was actually up until I was 28. Every summer I went out for summer camps, and I always have more affinity working with children. So that's the reason why. And
talk us through obviously from the Netherlands originally. Talk us through coming to the UK and doing that here, and obviously not in your mother tongue as well.
That's it.
And obviously the attraction of the NHS.
So I came to the UK about 8.5 years ago. I did my work experience for my care course here in the UK in Hampshire, and I made lots of friends, and every year I would come back for either Christmas time or other holidays, summer holidays, and they'd come and visit me in the Netherlands as well. And I kept in touch with them all these years, and then when I was 24 I was actually doing a drama degree, teaching drama, and I wasn't very happy, and I was just like, I was living in Arnhem, beautiful city, but it just wasn't feeling right. And I went home for Christmas one day, and I drove home and I was like, something's up. I was getting ill all the time, and my mum and dad were like, are you alright? I'm like, I'm not sure. So we had a talk, and I said to them, I was like, I think I'm going to quit uni. And I woke up the next day and I said to them, I'm moving to London. Okay. And 4.5 months later I was here. My friends rented a van and drove all the way from London to the north of the Netherlands to Friesland, picked me up and drove me back within about 24 hours. Right. And I've not looked back since. I've been back, of course, but that's the reason why I came to the UK, because it felt more like home. It felt more like me. I love the language. I love how the people live their lives. There's a sense of community that I really like. I'm not very much about the 2 o'clock in the morning club. I'm more about having a pint at 8 o'clock in the evening and then go to bed at night.
And how did you get onto the course?
So I got through to UCAS. Okay. So you have to, as a EU expat, you have to wait 5 years before you can actually apply to actually go into uni. I didn't know that.
I didn't know that.
So I applied firstly in 2013. So I lived there for 3 years, and I got rejected. And I was like, I don't know why I'm getting rejected, but everyone was saying no. And then 2 years later, I tried again, and I got accepted. And it was only then that I figured out that you had to have lived here for 5 years before you can actually apply. Unless you're self-funding or European funding, there must be loopholes around it, because of course you get foreign students coming in. So I applied for a couple of universities, and University of West London was the only one that I had actually spoken to on the phone, because I said to them, I was like, I've got a Dutch qualification, it is national level, like national diploma level, but UCAS was being a pain for me, so I couldn't upload anything. I couldn't really say what my former academic stuff was, and they listened to that and they gave me an interview, and the lady that gave me my interview also became a personal tutor. So she saw me from the start, and last week Friday she saw me graduate, so that was really nice.
Very good. And what's it like going through that degree, that 3-year degree, for people who are maybe looking to get into the nursing profession or looking to get a degree? What does that look like? What are you doing?
Now, I think there are many different stories to a nursing degree, and it depends on what university you go to. So I went to the University of West London, where we had 3 day parts a week, like 4-hour lectures, and so we were in uni for about 12 hours a week. That's for the time that you're at uni, and then of course you go out for your placement, so you go out for about 2,300 hours over 3 years. So in your first year you go out for 12 weeks, your second year it was 18 weeks, and last year, my third year, it was I think 22 weeks that we were out on placement.
Is this working on wards or working in care homes or hospitals?
For me, for children, it was mainly wards, health visiting. I also had a placement on an eating disorder ward in a private hospital. You can go to ICU, you can go to care homes. I think when you're adult nursing, I'm not 100% certain, because of course you're doing a different route. So I know some students go to theatres as well. So unfortunately we didn't get that experience, but you get the experience if you're in an environment where you can follow a patient's journey.
Right.
So I was very fortunate enough to actually see cardiac surgery. I've seen patients wake up after, like, in recovery, so it's like you do get to see the journey if you are a keen student.
Mm-hmm. And talk us through the highs and maybe the lows as well of being a student nurse.
So I'll start with the lows, because it's probably easier to start with the struggle of it. For me, it's the financial burden of being a student, the fact that I came from a job, I had worked full time, I had a okay income, I was living my life in London, and all of a sudden you go from having an income to having no income and actually living off a bursary. Now I'm very grateful that I still got the bursary, but I got one of the highest amounts because of just on my situation. But I can see people struggle quite a bit if they get a lower amount, or some of them sometimes probably got nothing.
Or none. Yeah.
And I think the struggle with having to pay for placements, I'm not saying that you have to pay for the placement itself, but getting there is always a cost. I had my placements in central London or in Reading, and I always had to get train tickets. You look at deals, but it's not as easy.
Especially with shifts, I suppose. Yeah.
Well, so yeah, you've got your shift work, so you're always paying peak time sometimes. For me, it was very lucky that I still got the young person's rail card. It's quite nice to say that I was under 25 when I'm actually 33. So it's like, but yes, I think that's one of the biggest struggles you've got as a student. It's just the link is lost between having your income and having a life that you're living is similar to your friends and your family, and all of a sudden you're a student again, and especially as a nursing student, we work 12 months a year. It's like you get time off in between, you have some annual leave, as they say, but we don't stop until June, July, and we're back again in September. Mm-hmm. Or like one of my placements, I had a break before the summer holiday, so I had 1 week off between my second and my third year. So you go, it's constant. Mm-hmm. Like all these other lovely students are finishing off in like April, May, and you see them go off and jet off and do like 3 months in the sun, and here you are still going on to shift. And in that way, it's a very, very different course to your normal university degrees. And then the highs for me is the achievement of actually completing it. It's one thing, but also for me it was a big change coming into an academic degree, especially with this being my third language. with Dutch and Frisian being my two main primary languages, to then finally do a degree in your third language, English, and actually do it so well that you qualify with the first class degree in honours. And I thought that's something that I can really be proud of. I started from first year not really expecting much of myself, because you don't know what level you're at, you don't know how well you're going to cope with the academic stress, and to then actually every year I managed to only have one of my grades to be below 70. Well, I was like, this is not happening. And they say to you that in your first year, if you get like a 70, in your second year and your third year would get a 60 and a 50. So if you grow with the course, in your second year would have a 70, and your third year would have a 70. And that's kind of what happened. I kind of got a good grasp of what was expected within the academic essays, and it was just really nice to see that I was growing with the degree, and that my knowledge was growing, and it was growing as well as at uni, but also on placement.
And obviously the bursary, I understand you have a few opinions or thoughts on that.
Well, I think at the moment many nursing students will probably agree with me that it was actually a shame that it got cut. It's a massive miss. You can see it in the applications. Like most universities are struggling to get nursing students to come in. There are branches of nursing where it is actually getting harder and harder to get nurses to apply. I know that learning disability nurses are actually scarce and far in between. It's not an easy subject, because actually, was the bursary the right thing? So that's another thing. Like, you can look at it from two perspectives. I don't think that the bursary worked in itself for most people. It was not enough. It limited in how much you could then borrow from the student loans company. Okay. So there's although you're getting some money, you still have some caveats that you then have to apply to. Then if you do have some time off and you earn money, you have to say that, and then the bursary lowers again. So it's like you have to be really careful about how much money you're earning every year, if you are actually able to make some money. And I don't think it worked well in that sense. But then, when you did have it, you at least had the certainty of having some income. You had the certainty that you would at least be able to afford your trips. I know many students who struggle to pay their rent, who struggle to actually make their monthly payments, who then struggle to get to placements. Because placements, as a nursing student, they're not always next to your hospital. Like, some universities are very lucky to be close to a hospital. For my university, we were quite sporadically placed over London, which is fine and great because you get an amazing experience, but that does mean that you've got a higher cost of getting there. So there's that. Yesterday, like lots of the nursing students and the newly qualified nursing students went to Parliament and actually asked for it to be reviewed. And I think it needs to be reviewed. Like, you can't not have nursing students apply and expect us newly qualified and those who are going to qualify in the next 3 years to take up all the places of the nurses that have left the NHS, that are leaving the NHS for the private sector or retiring. Because there's a load of nurses that are going to be retiring.
The baby boomers are coming into that period now, aren't they? And obviously they can take the pension, I think, at 55. Yeah. So I think there's a big period of them now coming through that are actually leaving the profession. I think they're saying the numbers are now going backwards.
It's like, you feel it everywhere. The word short-staffed is a commonality, I think, over the whole NHS, unfortunately. And I think that's a shame. But like, the one thing that I think people were saying about the bursary is like, oh, we're treating nursing students different to normal students. Well, that's kind of because we are different. We aren't the same. our course does not run the same. We do 2,300 hours and it's volunteering. We don't get paid for it.
It's a different type of course, isn't it?
It's a massively different type of course. It is very straining on your social life. It's straining on your mental health. It can be straining on your physical health, depending on how much you put into it and how much time you lose. I know people that have to travel an hour and a half, 2 hours to actually get to placement. Now, if you then do a 12-hour shift and have to travel back, that turns into a 14, 15, 16-hour day. That can't be healthy.
No.
And there must be something different that can be done with that. Oh, there's accommodation, fantastic, but not everyone can apply for that.
Okay. So well, you don't. Why would you not get the accommodation?
Well, it depends on how many people actually apply for it.
It's full, I suppose. Yeah.
If it's full, it's full. Yet again, it has to be funded. So, where does the money come from? Does it come from the university? Well, they've got hardship funds. It's like a cycle that just continues, and whenever you go, there's always a snatch. Like there's always a little hitch that you have to go over, and I think that struggle, it could be made easier. Like we as nursing students, we don't need that kind of stress put on us. We're already entering a profession that is asking a lot of us. We're going on to placements where a lot is asked of us. A lot of the students that I know from my last 3 years that I spoke to were at times wondering if they were not seen as supernumerary, because actually as students you should be supernumerary, but the wards were so busy that they were asked to take patients on, and sometimes that might have been too soon. But is that safe? I don't say. It's not safe. It's not safe for the students because they're being put in situations that actually they might not feel comfortable in, but they might feel like that it's a little bit of pressure because they want to help. There's a reason why we go into this profession, because we want to help.
It's vocational, isn't it?
It has to be there. It has to be in your heart. It has to be. You have to feel it. You have to want it. But it doesn't mean that you have to fill in the gaps.
No.
You have to be able to grow and learn and study and actually have someone watching you over your shoulders and make a mistake, like whatever that mistake might be. That allowance should be there. If you're then given care of 4 to 6 patients and you're the one making that mistake, but you didn't have anyone watching you, then the learning process is halted.
Well, yeah. Also, the patient. It's the patient care.
You're putting people at risk. And like with less nursing students, you just risk having a very, very minimal workforce in the end. I think I read it the other day that one of the hospitals unfortunately had to close down one of their wards. There's a reason why it's happening, because at the moment it's not working. No. People are struggling with their pay because, of course, we had the big pay campaign. Well, I rallied for it. I stood on Parliament Square and I had my banner up and I was like, okay, they came out with a plan. They said we can't do anything better than this for the next 3 years because of austerity. I'm like, okay, but then in now almost 2 years' time, we will probably stand there again on Parliament Square and we will rally again to get more pay for the workforce, because it's.
I suppose the difference is the UK versus maybe a US or a corporate structure is they would strike nursing is a big thing in the US. The vocational aspect of the NHS and people who work in it, that they won't harm the patients, and that's and sometimes is used against our nursing workforce.
That's it. And especially like coming from the Netherlands, where the healthcare system is privatised, everything's privatised. You pay into your insurance. Now, don't forget, we pay into our insurance here, but people just don't realise we do. National insurance is our way of actually paying towards the NHS. However, people say we don't pay for NHS, you do.
Yeah.
But like in the Netherlands, you have to have an insurance to actually be able to access the health service, but you can't live anywhere without insurance. It's a very good system in the fact that you will always be covered, whatever insurer you go with, and actually because it's a competitive market, instead of the prices going up, I think they've leveled okay. I do think my mum and dad pay an extortionate amount a month, but then I don't look at my payslip anymore because I'm just like, nah, I just don't want to know what goes out. I had my first paycheck last month, and I was like, fine, cool, I'll take it.
So talk us through. So you're a student nurse, you've nearly qualified. You know, how did you go and find your job, your first job, and then talk us through what does the first 7 weeks look like?
So I think I did it in a bit of a roundabout way than normal nursing students. Me and my partner, we really wanted to move away from Slough. His best friend lives in Cheltenham, so we've been going there for quite a while. So we actually kind of had a plan in our head that we wanted to move to Cheltenham. So I started looking at hospitals around there. And it turns out that one of my former university deans actually moved from his job from my university to become one of the chief nurses in Gloucestershire Royal Hospital.
Okay.
And I basically just sent him a cheeky tweet.
A tweet?
Yeah.
Very good.
So I sent him a tweet, and he tweeted me back, and he was like, oh, I'll be excited to have you here. And then we started, like, I sent him a DM, and I was like, so Steve, I've got some questions about my career. Can we have a little chat? It's like, how would I go about getting here? Because I've got a little bit of a career pathway in my mind. And he was like, well, there is an open day in February, but I'm not sure they'll be able to answer your questions. So come round, I'll show you around. So I came round in November last year, and he gave me a private tour of the hospital, of the children's ward, and I just immediately loved it. And I'm actually quite proud to say that that was the only hospital I applied for.
Okay.
I was like, well, if I don't get this, then
Think again, but this is your number one. Yeah.
Right, it was just, it had a lovely feel. The children's ward is like its own little hospital. Okay. Within the hospital, it's like you've got an assessment unit, a day unit, an outpatient unit.
Triage type thing.
Yeah, so literally it's all within the same area. And it's a lovely little entity. But yeah, he showed me around, and 3 months later I had my interview, and found out the same day. He was actually around on the interview day as well.
Okay.
He didn't do my interview. That would probably have been a bit biased. But no, I had my interview, and 5 hours later I had my acceptance email come through. It's quite an easy route to do it, because like you just have to make sure that you go into NHS jobs.
Yeah.
Make sure you've got an up-to-date CV. Have a good cover letter. If like at uni they were quite supportive, because I've already done jobs before.
Yeah, it works.
Yeah, it's like, and my partner was quite helpful as well, just because he's a teacher, so he does a similar system as well. So it's quite straightforward. It's more straightforward than UCAS.
We couldn't comment on that. But what does the first 7 weeks look like?
Do you know what? Don't start your job in October or November. Basically, no, it's an uphill climb. It's a learning curve. It's everything you want it to be and everything you don't want it to be at the same time.
Give us some examples.
Everyone's lovely, everyone's really helpful. You're coming in, you've got your newly qualified hat on, and actually everyone is supportive of that. Everyone knows where you've been, everyone knows that you've got questions, and they want you to ask them. They don't want you to sit back and just let things happen. They want you to talk to them and say, do you know what, I do not understand this. Can you show me? And if you have to ask them 10 times, they'd rather you ask them 10 times than do that once and then make mistakes. Yeah. But at the moment, especially on the children's ward, it's bronchiolitis season. So it is busy. So depending on what kind of placements you've had, that busyness can be quite scary. The anticipation of going into your shift, seeing a full-on handover sheet, that can be quite overwhelming. All of a sudden you're taking a handover for 4 to 5 patients, whereas as a student sometimes it might have only been 2 because you were working with a mentor. So I think that workload and your time management and ensuring that you've got everything at the right time, at the right place, the right medication given to the right patient, it's quite hard, and it's a learning curve that I think everyone kind of goes through. But then you speak to experienced staff, and they might have been doing it for 20, 30 years, and we had a shift last week, and it was just busy. It was non-stop. I think I ended up with having about 7 patients, like not at the same time, but like overall over the whole day. It was a turnover, and we had to clear beds because more patients were coming in and patients weren't going out. So so you're basically ending up with a hospital running in black. So basically meaning that the beds are probably going to be closed. Other hospitals are also closing down because they're to capacity, so you still got patients coming into your assessment unit. They still need beds. It was very, very difficult to then have the horrible conversations, but the most needed, like the needed conversations with your patients. You're well enough, like you're okay to go home now. And kind of like those conversations aren't easy, especially not when you've got an anxious parent who you'd normally probably give a bit of leeway to, because you want to give them support as well, because you're caring. At least you hope so.
And where do you learn those softer skills? Because one thing we always know about our nurses is that they're there to care for the patient, but we always know that they're there but they also looking after the family unit as well.
Yeah, so it's is
that something that's covered at university, or is that learning on the job, or is it learning from more experienced staff? It's that soft care of the whole unit that seems it's a big thing that comes out when we do these talks.
Yeah, especially with children's nursing, family-centered approach is key. So you look at the family as a whole. If you were to come in with your children and your little boy, your little girl is sick, fantastic, great, we'll put them in a bed. But how are you? Do you know where the parents' room is? Have you had a coffee or a tea? Okay. Making sure that there's not just a relationship with the patient, but there's a relationship with the parent is something that I really strive myself in. I like having a conversation, and I approach it with a bit of banter. So I try to have a little joke or something to like figure out the mood or figure out the personalities a bit better. If they're watching something on their pads, also, like if it's Paw Patrol or if it's Thomas the Tank Engine or if it's Ninja Turtles or Transformers, it doesn't really matter to me. I say something about it and I say, oh, do you know what, I really like Donatello, and it's an in. It straight away you see the child kind of relax because, oh, here's a goofy guy who just wants to look after me, and then the parents see that actually my way of being with their child is okay, because of course they're in a strange environment. There's lots of beeping noises, there's lots of people coming in and out, lots of people prodding them because they want something from them. Sometimes they need to give bloods, and I think some of it can be taught. I'm saying some. Yeah. I think at times that just kind of has to be in you. Okay. That personal touch, that personal way of approaching a patient, approaching a family. I don't think it could be taught to the extent that I think we sometimes want.
And what do you sort of see, some of the future challenges or even opportunities that are coming up in nursing over the next 5 to 10 years? I know we haven't got a crystal ball, but it's always interesting, especially from different viewpoints.
So there's a shift happening at the moment within nursing, and I don't know if if you feel it, but with new roles coming into it, it's trying to figure out how those roles actually fit in within the nursing picture. It's the nursing associates, the apprentices, let's have a look. Healthcare. So you've got the HCAs, but they already exist.
Yeah, the support workers, and then you've got the nurse associates.
MTAs.
Yeah, the apprentices.
And then there's another one that is linked to the professionals. Okay. So it's like a specialist role that means that they can work with any physician or any healthcare professional, and they're like their support. Okay. So there's all these new roles that are being created, but actually we've not seen them fully fledged yet within a working environment. Yes, they're doing the placements. Yes, some of them are already on wards and everything else, and I'm pretty certain they'll become invaluable. But for those hospitals that aren't training them, who have not yet advertised for them, who are not linked with a university in the same way that other hospitals are, I think it'd be a massive learning curve to finally have to apply or have to start asking for nursing associates, apprentices, to actually come in and be part of the workforce without actually knowing where they fit. What can they do? What can't they do? Can they do medication? Can they not do medication?
I suppose there's a training element there, isn't there, and a raising of awareness for the nurses on the wards for what these roles are, and also, the nursing associates themselves.
Yeah.
There's a communication thing there, isn't it? And also, nursing associates aren't there to replace nurses, are they? And I think we had someone on before who was worried they would have one nurse and 6 nursing associates on a ward, and they were saying that's unsafe. So I think there's it sounds like it's a help, but it's not there to replace a nurse. I think is kind of the viewpoint you hear.
And I think they were right in saying that, but I do think there's an element of replacement. I'm not saying that they're going to take away from the nursing workforce.
There's not enough nurses anyway.
That's, I think, the issue. Yeah. It's like the academic standards of someone to apply to become a nurse are getting harder and harder. The new educational standards, who I think they'll start, I think, next academic year, or maybe they've started this year already, I'm not 100% certain. At the end of 3rd year, whatever the 3rd year's nursing student is going to be doing is something that I'm only learning now. So they're going to be taught how to do bloods, how to do IVs, how to do a wider variety of skill set in their 3rd and final year that actually we haven't been taught, but we're being taught in our preceptorship. So I think there's a shift in that as well. So does our responsibility as a nurse, is that going to transcend what we're doing now? And are we going to be more focused on the medical side of things? Are we going to be looking at nurses becoming less patient focused? I wouldn't be surprised if we were. I'm not saying that's going to happen. Like you say, we haven't got a crystal ball. No. But with the input from the other professionals coming in and help, like the associates, like the apprentices, I feel we can't be certain, but there is a change, and I think what's going to be expected of us as a nurse is going to change.
I know one of the subjects we spoke about just off complex care and disabilities. Yeah. That's a big passion of yours.
Yes.
Good to hear your views on that.
So, as I said, my care experience is very varied before I came into nursing, and I had an experience before I started to become a nurse where I was working in a care home, and one of my residents had hurt himself and was bleeding. But not profusely, but was bleeding. So we called the local A&E department, and we said, we've got a resident, he's got behavioural problems, but we're going to bring him in with 2 carers. Is that okay? Oh, we're not sure.
Because of the behavioural issue?
Can you take him somewhere else? It was a bit shocking. It was just like, okay, we're calling you, we're telling you that there's support there, he's actually okay now, he's not lashing out, he's not doing anything that's aggressive in that sense, but they were still worried and they were still a bit wary about him coming into the ward, even with that support in place. We spoke to him, we told him that he needed to go, and because he was like, yes, it hurts. So that was the first time I kind of realised that there was a gap. And then I started my training as a nurse, and I saw the same gap happen on the wards. Not with everyone, not with every professional, but some professionals were more comfortable and confident in looking after patients with complex needs, be it learning disabilities, be it physical disabilities. And an idea started brewing for my dissertation subject. And that's, I think, probably in my first year that started brewing. I really tried in my first year not to look back at my experience. I really tried to take it all in, but I couldn't stop. And in my second year, I think at the start of second year, I saw this flyer from the RCN about a project called the Celebrating Nursing Practice project. And it was looking at innovations of care. I was like, well, do you know what? I've got an idea. I'm just going to blag it. I reread it. It's like the spelling mistake mistakes were horrible. But I got accepted, and I was one of, I think, 128 people that applied, and about 80-something people were accepted onto the project. It took me about a year, I think, to actually go through the project and actually finalise my final draft, which is a toolkit for healthcare professionals in how to look after patients with complex communication needs. And I'm very, very pleased to say that I'm one of the 4 who got the funding in the end. And I'm now actually developing my toolkit, which is going to be an online resource, which is going to be available on the RCN website.
Very good.
So it's looking at improving patient care. It's looking at making the anxiety less for staff looking after them. Because when I was doing my research, actually about 3 patients a day pass away, unfortunately, because of medical mistakes. It's because of anxiety, it's because of lack of confidence, because of not asking the right questions in the right way, that actually things are missed. And sometimes those things that we miss are the most crucial part. So how do you communicate with someone with a learning disability or with a communication issue, communication need, I mean. How do you converse yourself? Do you stand there and do you wave your hands a lot? Or do you sit back and do you try and see the person first and then gauge a little bit? Have they got a carer with them? Are they okay with you talking to the carer? Have they got a voice? Have they got an app? Have they got a computer? It's all these things that I think in a fast-paced environment like the NHS that they're missed. Not all the time, I'm not saying that everyone's horrible at it, but they're missed, or you don't know about it. And I think that's where the anxiety comes from. Oh, I don't know how to care for this person. I don't know how to look after them because I've not done that before.
Right.
Okay, well, here's your chance. And then you can learn from the patient, you can learn from the carer that's with them. Or if you've got someone like myself who's very comfortable in that kind of situation, I'm not saying that I know every single answer, but I'm okay with approaching them. Then work together. Don't say, oh, do you know what? Ewout's on today. He'll be all right. Like,
what happens if you're not there? Yeah.
My approach would be, right, you're a bit anxious about this. Why not work together today? And then tomorrow, hopefully you'll be okay. And if you've got questions, come to me. Or if you've got questions, go to the learning disability specialist. There should be a specialist nurse in almost every hospital. Ask the questions, become more comfortable with it. Because in doing so, you're going to improve the patient outcome. You're going to improve your own experience as well. And actually, by improving their experience, you are more likely to hear the right things, understand what they mean, and care for them, and actually make sure that they leave the hospital healthy instead of, unfortunately, passing away. So yeah, that's why I'm really passionate about it.
No, you can tell. Well, it leads us nicely on, talking about best practice, leads us nicely on to be, you're one of the ambassadors for the Academy of Fab NHS stuff.
Yes, apparently so.
What's your role there? What does that mean?
Well, that's a good question. I actually, I've only recently been asked by Igna Rib to actually become part of it. So I'm not really sure where they want me to go with it. I think one of the things that I do is I blog, I tweet a lot about I like positive messages.
And your blog's Life, Nursing and More?
Yeah, so it's because although you're a nurse, there is life to be had. So I talk a bit about my own experiences of being a student. As I will start blogging again about my experience of being a newly qualified nurse.
And where can we find that?
That's on WordPress.
On WordPress?
Yeah.
Is it on your Twitter?
Yes, it is.
As well, yeah?
Yeah.
Put that in the bio at the end.
And I think it's important for all of us to reflect on what we do, on what we see and what we learn. But I also find that it's important to share. Because because like the one thing that I don't really get about the NHS is that every trust has got its own little world, and no one talks to each other. Oh, do you know what? That trust does that, but oh, we can't take that. Yeah. Actually, you're the NHS. Like, you're all working towards the same goal. Why would one hospital invent the wheel and the other hospital have to invent the wheel again?
Yeah, that's why we like the Academy of Fab NHS stuff, because they're sharing that best practice, which only helps the patients and makes everything better.
Sharing experiences, sharing information, and sharing your knowledge. Because what's the point of you just keeping it to yourself? So I think that's kind of how I fit into that, and I'm looking forward to actually like really getting stuck into the role. And
how often is it a weekly thing? Is it, or just when the mood takes you?
Yes, when the mood takes me, especially at the moment. Well, at the moment, time was very, very scarce with having just moved house, starting the new job 4 days after moving house, and we're also planning a wedding for next year. So
okay, just a bit on the part time.
I think there's 3 stressful times in your life, right?
Yeah. House, job, wedding.
So I think I've covered it.
Yeah, I agree on all of that. And what would you advise newly qualified nurses, or even taking one step back? What would you advise someone thinking about doing a nursing career now?
Well, the one thing that I would advise them to do is go to open days, go and spend some time on a ward. Don't jump into it. It is a hard profession. If your heart's in it, fantastic. But if you're doubting, go and check it out, because this changes your life. It changes how you see life. You look after the sickest of people. You look after very, very poorly little bubbas, or after very poorly elderly people, and make sure that you're okay with that. Make sure that you're okay with being in a vulnerable position yourself, because you kind of have to be able to be okay with that. It's not easy to finish a 12.5-hour shift and go home and then think, I hope that patient makes it, or I wonder how that surgery went. But being able to let go and being able to go home and breathe, still have a life, that's a skill in itself, and that's something you don't get taught.
And what about as a newly qualified nurse, obviously with your extensive 7 weeks experience?
Oh, it's a massive amount of experience. Ask questions.
Yeah.
Ask them the socks off, is basically what we say in Dutch, I think.
Okay.
But basically keep on asking, and if you're unsure about something, don't worry, we all are.
Yes.
And if you talk to someone I spoke to one of my colleagues, and she was like, I don't know that. And she was 20 years in, and I'm like, fantastic. And she was like, and I struggled the same day that you were struggling, that you went home and you probably cried, but I did the same thing. They're learning as well every single day, but talk to them. Because I think sometimes we're scared to talk, especially to those who are more experienced. And I'm like, they've been there, they've done that.
And they're happy to share the experience. I think you'll find nurses will tell you that this is how it works, or that's how it is. They'll share that. And you hear, so we've had doctors on this, and they've said that they've learnt most of their experience from nurses. Yeah. Because the nurse has been, they're a newly qualified doctor, and they go in and there's a nurse on that ward for 20 years. They tell you exactly what to do, and they give you that experience. So it's a sharing culture.
It really, really is, and you really know when there's a good team of doctors around as well, because what I like is the fact that they don't treat you anything different than themselves. They come and they have that chat with you. Yes, they're the one making quite important decisions, but if you think something's wrong, or if you think something is up, and you say that, they will go and check out that patient. They will go and see their patient.
It's evolved, hasn't it, over the few years? Before it was, the doctors high and mighty, but now it seems more of a team atmosphere.
Yes. Well, especially in pediatrics, where pediatric doctors are, especially on a ward like mine, so busy, where they're relying on the nurses to actually keep an eye on the sick patient.
Yes, the eyes and ears, isn't it? Yeah.
And if we eyeball a patient for 2 seconds and we're like, something's off, straight away you can go to a doctor and say, do you know what, can you just check out on this patient? And they do. And 5 minutes later they could come to you like, yeah, give them some more medication, or it could be completely something different. But it's become teamwork. But yeah, ask questions non-stop, because there's only one way to learn, and that's not by sitting back.
No, not indeed. So just finishing up, is any message you'd like to give to our nursing workforce or anyone who's watching this about nurses or to our nurses?
Oh yes, like my final message would be get stuck in.
Okay.
Don't just let it happen. Like, I know there's nurses out there who are perfectly happy with where they are, with being a band 5, and there's nothing wrong with that, and be a fantastic band 5 or band 6. Like, if academic writing isn't for you, don't do that. I'm very proud. I in my third year I had an article published in Nursing Children and Young People, a proper published thing. I'm a reference now, which is weird. Yeah. I did my project, which I'm now working on, and I got a lot of money for funding for that, and I wouldn't have gotten that if I just sit back and relax and let it happen. I have a great following on Twitter. I've made many nursing friends through Twitter, through my involvement with the RCN, through just being vocal, but vocal in a positive way. Just get stuck in. Don't be afraid of actually sharing your opinion, sharing your knowledge, and get on Twitter, because actually it's an amazing resource.
What's your Twitter handle?
At Ewout 1985.
Very good. Thank you so much for your time today. Thank you for coming to the Voice of Nursing today. Thank you to all our nurses, doctors, healthcare assistants, support workers that look after us all, and we'll catch up with you again soon.